Right, okay, so introduction.
My name is Helen,
right.
and I came in to see Dr. Rutledge to cure my diabetes because, well, my mother has diabetes, and she had a non-healing wound, and I didn't want to go through that. She's currently in the hospital with a broken leg, which is caused in part by a bone infection caused by that same wound. And that's why I'm here this week to visit her. Before surgery, my A1C was 10.5.
Ouch.
Yeah, really
Can we
high.
stop and tell everybody what that is?
It's the 3-month average of your glycated hemoglobin.
That's the hemoglobin dipped in sugar.
Yeah, it's sticky and it just doesn't work right.
And the research shows that if you want to predict problems in a diabetic, you can just look at that number. So if you want to know your chances of a heart attack, your chances of a stroke, your chances of a blindness, all those things, you can measure that. And normal's below 5. Not so good is between 6, 7, and 10 is...
Panic time.
Yeah.
Yeah.
I don't know about panic, but it's not good.
Yeah.
Oh, hi, Mom and Dr. Rutledge. I think Sarah said hi. Say, what are you doing, Sarah?
So anyways, 2 weeks after surgery, my diabetes was completely gone.
Pardon me?
It was gone.
I can't hear that enough. One more time.
It was gone. But
Oh, okay.
the next week it was back again.
Oh, okay.
Yeah.
So what's the latest?
It's been going down.
Right.
My last A1C was 6.7.
Oh,
that
it's
was
getting
last
there.
month.
Right.
And if you go by the average on my glucometer, it would be 5.8.
Getting close to normal.
Yeah, getting closer.
And what are your sugars running?
They're very good.
Yeah. What numbers?
In the mornings, they're 86 to 113,
Good.
which
All
is
right.
good.
And what are you having to take for that?
About maybe 3 times a week, my blood sugar gets high enough that I have to take some insulin.
And before surgery, tell me how much you were taking?
90 units.
90 units of insulin every day.
Yeah.
And now, some days none.
Most days done.
Most days done. Some days 10, 15 units?
5.
Some
at
days
the most.
5.
At the most.
Okay. So a normal week before surgery, it'd be 90 times 7, which would be 560 units or something like that?
Yeah.
And now most weeks it's 5 times 3 is 15.
That's right.
And you're 3 months out?
3 months.
So we got a shot.
Yeah.
We got a shot. Now, does your doctor want to take you off the insulin? Maybe use a little tablet or something?
I've tried the metformin and
Yeah.
it just
It
makes
knocks
me
you down.
Yeah, nauseous.
Okay. So you're okay doing a little bit of insulin every once in a while?
Right.
And when you say a little bit of insulin, you measure your sugars.
Yes.
And how high do they get when you take that 5? What's a...
150.
Right. Not too bad.
Yeah. If I take insulin, if it's 140, I might have a low.
Good.
Yeah.
So I think what we're saying here, this is kind of technical if you're not a diabetic, but before surgery, pretty significant diabetes as measured by sugar and the amount of insulin she had to take. And now she's getting a lot better. She's at 3 months, and she's, I would say, almost off your insulin. Some people walk around all the time with sugars of 150 and don't take insulin for it.
Mm-hmm.
And you're being very extra cautious and careful. And with your diabetic measure, that hemoglobin A1C is on the threshold of the 5s, which is the threshold of normal.
Right.
Good. That's pretty good.
I feel good.
Do you really? Oh,
Yes.
How do you feel? Do you feel different?
Yes, I do.
Really?
I have a lot more energy.
Mm-hmm.
I feel more mentally alert.
Really? You can tell a difference?
Yes, I can.
Oh. Do you think the sugar was doing that?
I have no doubt.
Okay.
Yeah. If your blood can't carry the oxygen to your organs and your brain
Yeah.
because it's covered with sugar,
Yeah.
you're going to feel sluggish. Your brain isn't going to be working right.
And you can tell that kind of difference, you think?
Yes, I can.
And we forgot the other number to ask is your weight loss.
I weighed this morning and it was 173.
Good.
When I applied, it was 222.
Ooh, pretty good.
So I'm going to ask you, is this ever going to stop? If I'm 3 months out and I'm
That's a good
more
question.
than halfway to my goal weight.
Right. Isn't that dangerous?
Yeah, is that kind of dangerous?
The weight loss is logarithmic.
Okay.
Remember this from high school, guys? Logarithmic. So what we find, here's our numbers for our average patient, and then we'll come back to you. Our average weight loss... Our average weight loss... okay. Our average weight loss for our average patient. Our average patient, we've now done 4,580 people. Of that group, if you put them all together, the average is right at 300 pounds pre-op. The average weight loss at 1 month for our average patient is 30 pounds. The average weight loss at 3 months is 50 pounds. And the average weight loss at 6 months is 80 pounds, and at 1 year is 140 pounds. So lots of weight loss early, and then it slows down. Mm-hmm. So we would expect that you're just going to slow way down. Now, there is a risk, and how much did we bypass in you? I'm sorry.
5 feet.
Yeah. There is a risk that that's too much for you. We wanted to hit you pretty hard with the bypass because we wanted to get rid of the diabetes. And I think you're going to be okay, but we'll have to wait and see. And God forbid, it would be a terrible complication if you lost too much, but we could fix it within 30 minutes with another surgery if we had to. That would be terrible, and I would apologize to you, and it'd be my fault, but it happens sometimes. Because as we joked about, I think we said in clinic, we just don't know precisely where to bypass.
Right.
And I think you and I kind of went back and forth a little bit about what's precisely the right amount to bypass.
Well, no, I trusted your judgment.
Okay. Well,
you're the expert.
I think 5 for your diabetes is a lot. And it's what we wanted to do is to get rid of that diabetes. And I think 5 will be good for you.
Okay.
Yep. And so I don't think that it's worrisome that you've lost this much by 3 months. We would expect kind of in this range.
Okay. Because I was getting kind of concerned about that.
Well, most of my patients are concerned of one of two things. They're calling me because they haven't lost enough, or they call me because they've lost too much. Mm-hmm. They're all calling me. But you can never...
Can you imagine that, losing too much?
Yeah. Everybody is always calling me. They've either lost too much or too little. They're always calling. So I understand your concern. You're probably... If you think about it, how many of my patients did you talk to ahead of time?
11.
Okay. And plus you talk to people on the mailing list?
Yes.
Okay. How many lost too much?
Not very many.
Right. It's not many. So your chances are pretty good.
Okay. And I wanted to, my doctor wants me to go back on lovastatin.
Mm-hmm.
How do you feel about that?
Well, lovastatin is a wonderful drug.
Mm-hmm.
The problem with it is it can damage the liver and damage your... And what we are worried about is if you do our surgery plus lovastatin, you can increase the damage to the liver.
Okay.
So what we would ask you is if your doctor could chat with me on the phone, I'd love that. We would prefer to wait a little bit longer and retest your cholesterol and triglycerides, and I think he's going to be happy that it's appropriate to stay off it.
Okay. My triglycerides, by the way, were down in the normal range, which has never happened before.
Pardon me?
Never happened before. First time since I've been taking the blood fat tests.
Yeah, the triglycerides are a measure of kind of fat and grease in the bloodstream, and that's going to go down. Your cholesterol is going to go down. What we expect is all the measures that predict heart attack and stroke and blindness and things like that are going to start getting better. Just like you've seen the hemoglobin A1C come down, the cholesterol is coming down, your blood pressure is coming down, your C-reactive protein, all these kind of scientific measures of risk are switching, are changing towards the better. But what can happen, of course, is there's no way to say because the stomach can empty partially if it starts to fill up. So that's like asking, people ask how much can you eat after the MGB, and one day they can eat one amount, and the next day they can eat 4 times that amount. And the reason for the difference is that it just empties out into the gut, so it varies. It's like if you can eat a lot if you gradually eat slowly. Just sit down and eat slowly. You can eat during the entire football game. All of a sudden, all the wings, all the chips, everything's gone. Where did it go?